At 33 years old, Melissa Carter had her life neatly planned. A rising executive, recently engaged, and no intention of starting a family, at least not yet. But that morning, as the bathroom light flickered and the silence thickened, she stared at the test. 2 lines. Positive. Her hands trembled. Her heart raced. But something didn't add up. She hadn't missed her period. She had no symptoms. And she hadn't been intimate for months. Then came the whisper in her mind. What if it's not a baby? Melissa rushed to her doctor. Blood was drawn. Ultrasounds ordered. She braced herself. Maybe she was wrong. Maybe the test was faulty. But then the call came in. Her HCG levels were high. Human chorionic gonadotropin, the hormone that confirms pregnancy. Still, there was a problem. No fetus, no gestational sac, nothing, just elevated hormones. That's when her doctor said something that made her blood run cold. This could be a sign of cancer. Melissa was admitted for further testing. Her levels of HCG weren't just elevated, they were skyrocketing. Yet every ultrasound showed an empty uterus. Her symptoms? Almost nothing. No nausea, no breast tenderness, no abdominal swelling. And then something appeared, not in the uterus, but on her ovary. A mass, small, dense, and producing HCG. The doctors now had a name for this nightmare: choriocarcinoma. Choriocarcinoma is a rare and aggressive cancer. It arises from the same trophoblastic tissue that forms during pregnancy. Yes, this cancer can secrete HCG, the very hormone that pregnancy tests detect. It can trick not just the body, but the mind. It may follow a miscarriage, a normal pregnancy, or a molar pregnancy, or in rare cases, appear spontaneously. It grows fast, it spreads faster, and if left untreated, it's fatal. Melissa began emergency chemotherapy within 24 hours. Her case was rare, but curable thanks to early detection. The HCG levels, once off the charts, slowly dropped. The tumor shrank, and 6 months later, she was in remission. A positive pregnancy test can mean more than just new life. Sometimes it's a warning sign. False positives are rare, but not impossible. They can result from certain tumors, molar pregnancies, recent miscarriages, even some medications. That's why every positive test must be followed up, especially when something doesn't feel right. Melissa's intuition saved her life. Her gut knew Melissa wasn't pregnant. She was facing a deadly disease hiding behind a lie. Her story reminds us, not everything is as it seems. Even something as familiar as a pregnancy test can mask a deeper truth. So listen to your body, ask questions, and never dismiss the whispers of doubt. Because sometimes, a false positive could be a life-saving warning. Subscribe for more real-life medical mysteries. Turn on notifications, because your health may depend on what you don't know.